When Elizabeth Weller's water broke at just 4.5 months pregnant, she was told it would take a miracle for her daughter to survive.
It was the not being able to see her take her first steps or send her off to school for the first time.
While Elizabeth was at a high risk of infection, she was told she was not sick enough to immediately end the pregnancy.
So you're basically sent home to get sicker?
Yes. The nurses essentially told me, you're being sent home to develop the signs of an infection.
Days later, when she was infected, doctors finally induced labor. And while she and her husband are still mourning the daughter they named Theodora, a new study shows their experience is not unique. Researchers looked at 28 recent cases in Dallas where doctors had to delay care until there was an immediate threat to patients' lives. Nearly 60% developed severe complications. One was in intensive care, others given blood transfusions. Only one baby survived, so underdeveloped it needed life support.
This is what happens when we cannot provide the standard of care right up front.
Houston Dr. Anitra Beasley recently published similar findings on the Texas heartbeat bill called SB 8.
What we found was that SB 8 really created a chilling effect on reproductive health care. Physicians were unclear if they could counsel patients, refer patients, having to really wait until something became life-threatening before they could intervene.
State Senator Brian Hughes wrote SB 8 and admits he's troubled by the recent study.
Maybe they're confused by the law in other states or misled by other stories, but for those medical emergencies, the law hasn't changed.
How close to death does a patient need to be before SB 8 would allow termination?
Under Texas law, a doctor sees that condition and based on a reasonable medical probability knows this is going to happen. They can act. They do not have to wait for a condition to be aggravated.
He says there has been outreach to doctors and hospitals to clarify. But for Dr. Beasley, there is nothing clearer than the studies.
So is the data that you're seeing a warning to other places considering bans?
If it's not, I think that it absolutely should be.
The Wellers also worry about the future.
It makes me not want to start a family here. It's not safe.
They say they've seen that firsthand. Kristen Dahlgren, NBC News, Houston.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.